Good evening, everyone. My name is Stacy Stanley, and I am the superintendent for Edina Public Schools, and I am really excited to be here with you this evening. Thank you so much for joining us. I am appreciative of the opportunity for us to learn from Dr. Nick Kelly and then have the opportunity to join in together in the ability to listen to one another, to hear others' perspectives as we seek, as a district, as I seek to garner your ideas and to garner your considerations that we should look at as we move to develop and finalize our 2021-2022 return to school plan. And so I am going to invite Dr. Nick Kelly to join me on stage here. Thanks again, Dr. Kelly, for being here with us this evening. Everyone, what I'd like to say is we know that there are going to be many questions that come in, and so you should see a link to a form where you can submit questions. Now, I will be moderating those questions this evening. I will try to get as many of them in, but my goal is to make certain that the community voice is present and it's engaged. And so any questions that I don't get in during next presentation, I will be working with our communications department to make sure that they get answered via a FAQ that will be posted on our 2021-2022 family dashboard page. So again, I will take as many questions as I can during the presentation, and then we will make certain that your questions are answered in an FAQ. So please continue to add your questions to the form that we have created for you. So without further ado, I'd like to welcome Dr. Nick Kelly, who is our public health administrator, and he is an epidemiologist. Having come from a district where I didn't have access to an epidemiologist at my fingertips, it has been really great to get to know Dr. Kelly. So Dr. Kelly, go ahead.
Thanks, Dr. Stanley. It's a pleasure to be here and talking a little bit about COVID and some of the realities we're thinking through for the return to school. So I'm going to do a little background of why somebody from Bloomington Public Health is talk about COVID status, public health guidance, and then talk a little bit about some myths with COVID-19. So first off, I want to just acknowledge this has been our third school year we're talking about COVID. It cut a school year short, dramatically changed an entire school year, and this is our third school year where we're dealing and managing with COVID. Focus on what you can control. Think about how you can manage stress, reality. It's stressful for parents and it's stressful for the kids that we're getting ready to send back to school. And so think through what you can be doing to manage that and look for the good things. I always like to talk about look for those helpers, the people doing good stuff in the community, helping everybody. What is public health? Public health is not the organization that just says you can't do certain things. Public health as a field is focused on what we as society do to assure people can be healthy. That's what public health is all about, is making places for people to achieve their greatest potential. And Bloomington Public Health has been serving the city of Edina since 1976. And in case you're wondering why we're talking about COVID with the city of Edina, Minnesota Statute 145A talks about what community health boards do. The city of Edina is a community health board, and we're dealing with the reality of preventing the spread of infectious disease, which is one of our statutory responsibilities towards the city of Edina and their residents. Bloomington Public Health, as I said, has been doing this since 1976. And our mission is to engage the community in promoting, protecting, and improving the health of all. A lot of our work is focused on the population Edina Public Schools serves. We're very focused on young kids and ensuring they have the best future possible. And feel free to look at our annual report there. but it talks about the wide variety of work we do, and most of that is focused on young kids. So SARS-CoV-2, that's the name of the virus that everybody calls COVID. COVID's the disease. SARS-CoV-2 is the virus that causes the disease. And this is a graphical representation of what electron microscopy and a computer image looks like of SARS-CoV-2, the virus that's causing us to have all these conversations about COVID. Like many of you, I vividly remember when we found the first case of COVID here in the United States, or in Minnesota, on March 6th. And then a few days later, all of our worlds changed. I'm a parent of 3 little kids. So when the governor released the plan about what we're going to do with schools, I was feeling the same thing you all felt, trying to figure out what am I going to do with a kindergartner trying to finish the end of the school year and think about first grade. Not an experience I want to deal with again. And then we saw these executive orders really driving the change, the guidance, and how we worked across the state. Well, the good news that I have for you is I don't see that happening again. This is looking at case rates in Edina over the last, it's a 7-day rolling average per 100,000. And you can see all the way on the left, we had that beginning March starting to go up. We had that July spike in Edina where the mayor in the city put in that mask mandate. And then we started the school year and we had that really steep rise in November. Had that additional peak after Christmas, went down, and then we saw our March surge with Alpha, the B117 variant. And you can see we're starting to tick back up a little bit. We are in a very different place than we were at the start of last school year. And I think this school year is going to be very different. We have different tools and processes to manage COVID, and that's namely a vaccine. Here in Minnesota, we are doing really, really well with vaccine coverage. Our vaccination rates are really good. In Edina, they are doing really, really well from a vaccine standpoint. So about 81% of Edina's population over 12 is fully vaccinated. That's remarkable, and that is really going to help change the trajectory that we're seeing here in Edina. About 84% of the population has had at least 1 dose. Now, when you think specifically about school-aged, Edina did some phenomenal work with the district, with some very engaged and passionate parents last year. And 68% of our 12 to 15-year-olds in Edina, we estimate, are fully vaccinated. And for our 16 to 17-year-olds, it's about 82%. So that's phenomenal coverage. And 76% of 18 to 49-year-olds in Edina we see as fully vaccinated. We do see a bit of a difference by race or ethnicity. So Black, non-Hispanic, and Hispanic populations are about 56% fully vaccinated. So we have good vaccine coverage in Edina, and that is really going to change what we see with some of the trajectory and concerns we have moving forward. So something else that's changed and become more clear is how COVID impacts our kids and the youth in our community. Originally, we were thinking it was a minimal impact, very little transmission. Some of those realities have changed, and our data has become really clear. Kids get COVID just as likely as adults and other people in the community. And we've seen some interesting dynamics change across the country as people were not in the workplace and schools were in session, and then both things were in session, and then things changed over summers. We see a bidirectional relationship with basically community spread and cases in the schools. And we've gotten really good data over the last school year of what works really well to prevent cases of COVID in the school setting. And one of the number one things is to have really low rates in your community. And then there's lots of mitigation strategies that can be put in place that can really limit the spread of COVID in the schools. And that's what the CDC and MDH guidance is based on, is the evidence base that's been acquired over the last 18 months to how we can keep kids in the classroom, because that is the primary goal, is to keep kids in school, learning in front of incredibly talented teachers and growing with their classmates while protecting them from COVID. We've seen some changes, especially in the last week, around vaccination and COVID. And the thing I want to highlight here is vaccines are an incredible tool, and they are incredibly powerful way to change the trajectory of this pandemic. The media stories about what's been happening with Delta and vaccination are a little bit misleading. The vaccines are working as well as we expected. They are providing phenomenal levels of protection against death and severe illness. And they're doing a really good job preventing people from getting sick, symptomatic illness. That's what those vaccines were designed and tested against, was preventing symptomatic illness, hospitalization, or death. And they're doing a great job at it. So while there was concerning stories in the press, the safety, the efficacy of how well these vaccines work is right where we would expect it to be. And they're performing phenomenally well from that standpoint. The Minnesota has provided guidance on how to handle confirmed cases of COVID. And so it's important for everybody to realize Minnesota statutes, it's actually Minnesota Rule 4605.77, actually requires schools, childcare, other child serving facilities to report cases of COVID and many other infectious diseases to the state health department. So that's one of the things that will happen at all schools. That's one of the non-negotiable COVID reality. It's a reportable infectious disease. And so cases of COVID will get reported and processed as we work to make sure our kids and our community stay safe this fall. The CDC put out some very robust guidance that was updated quite a few times over the last year, and most recently in early July, about how we manage and provide safe learning environments for our children. It is tied somewhat to some case rates and processes for one of the mitigations they recommend, and that's screening testing. But in general, the rest of the recommendations are there as layers of mitigation to keep kids safe. MDH basically took those recommendations, reviewed it, agreed the science is rock solid on the best way we can protect our kids while focusing on keeping them in the classroom and minimizing those disruptions. And so they put out this guidance for school districts to follow. And we'll highlight some of the key points in that process. But first, wanted to draw your attention to the metric that the CDC is using to drive decision making is based on case rates. And so you can get case rates from the CDC. It's covid.cdc.gov. And then there's the COVID data tracker. And so as of this afternoon, Hennepin County was at 65 cases per 100,000, which puts us in the substantial transmission. And so this is a little different than what you've been used to with the cases per 10,000 over a 14-day period. This is cases per 100,000 over a 7-day period. And it's county, not city-based. The reality behind that is recognizing as much as we all like to think our communities are islands and they're just these amazing little places, Edina is not confined to its borders. And so staff, support staff, teachers, students are coming from all over the metro to work, teach in Edina. That's a testament to the amazing district. But that also means what stays in Edina what happens in Edina doesn't always stay in Edina. So the reality is COVID cases occurring anywhere in the metro, especially within Hennepin County, have an impact on what's happening in Edina. And so Edina's case rate's lower than the county case rate. But throughout this entire pandemic, our case rates have been tracking with Hennepin County very closely, along with the state of Minnesota. We're often under it, but when they go up, we tend to go up. When they go down, we tend to go down. And so using the county metric is a good way to understand what's going on. And then getting vaccinated. As I've said, vaccination is the best single thing you can be doing right now to get your kids into school and be safe in school. And as a parent of 3 kids, I am anxiously awaiting when I can get my kids vaccinated. I will have a kindergartner and a 2nd grader starting school this fall. I cannot wait until they can get vaccinated. We don't have as high of a vaccine coverage as I think everybody would like to see. It'd be great if all of our students were in the 80s to 90% vaccinated, and our community rates are getting that close, but our youth rates aren't quite there. And so the more you can do as parents to get support vaccination, it's incredibly safe, very effective, and it is the single greatest intervention we have right now to help you have a normal school year. So the school guidance, as I said, vaccination is key. That is the cornerstone of this entire process. The adults around your kids, the parents, the coaches, anybody else involved in their life on a regular basis should be vaccinated. And that is one of the ways you can make sure COVID doesn't enter the reality. That's something that we do as I do as a parent with 3 kids that can't be vaccinated is I work very hard to make sure they're not around parents that aren't vaccinated or other adults that aren't vaccinated. And we take mitigations to protect them in places we can't. So the idea of people starting to put on a mask now because we had a certain case level, my partner and I have been masking since masks went on. We've never stopped. The best practices for COVID operations, and they're called best practices because this is the evidence-based data we have for driving how to protect kids in school environments based on experiences we've saw in the last 2 school years. Masking is at the top of that list. The ability to have source control and then some aspect of protection for the wearer is a phenomenal tool to control a respiratory pathogen like COVID. When everybody's masked in a classroom that has a HEPA filter, you see a dramatic reduction in particles in that classroom. And that means everybody's breathing and inhaling cleaner air and seeing less COVID in that environment if it gets introduced. It's a relatively straightforward, simple process that my kids seem to be surprised when they're not wearing a mask and we go somewhere. They're like, don't I need to do this? I'm like, nope, we're doing it outside. We don't need to go inside anywhere. They seem accustomed to wearing it. Physical distancing is another thing to think through. The keeping at least that 3 feet of distance and a little bit so you don't get some of that direct droplet reality, and maintaining some of that cohort is a good strategy. And we've seen that consistently. Distancing plays an important role. Isolation and quarantine, they're hallmarks of public health tools, and that is one of the key things that we expect to continue to see. Simply put, don't come to school sick, whether you're staff or you're a student. Coming to school sick means everybody else is getting exposed to whatever is causing you to be sick. That's not saying allergies. Allergies are a reality, but it is if you're coming to school with symptoms that are consistent with COVID, you need to know it's not COVID. And getting people out of the school whether they're staff or students, that have symptoms, and out of that environment protects everybody else. And then that's that isolation. So if you do have symptoms, you're staying home for a period of time. That is a frustrating reality. As a parent, I know that feeling when you wake your kids up and getting ready to send them to school or daycare, and there's a cough and they're just not feeling well, and you got that 20, 30 minutes to figure out, my entire day just changed. I'm hoping that is less frequent this school year with the vaccine coverage, but that's a reality that unfortunately we know too well. But that does so much to protect all of their classmates and the rest of the staff in the building. Screening testing is something that is encouraged, especially when we're dealing with high rates in the community. And that is a way to do something similar to Test the Nest last year, where you're doing regular testing to make sure that nobody's coming in with an asymptomatic case. Kids are more likely to be asymptomatic. We've seen that, and we've seen when you do more robust universal testing, you can detect, prevent, and maintain operations much better than if it's just the sporadic testing. And then ventilation. I know Edina has done phenomenal work in getting HEPA filters in the classroom, changing their ventilation system, and really doing a lot of work to make sure that the air your students are in all day is as clean and safe as possible. And that is something that we probably don't talk enough about from a public health strategy of how important it is. It changes some of those dynamics when you're in an environment that has really, really good ventilation, like a school. It changes the reality for what we're seeing with COVID. The frequent hand washing and good respiratory etiquette, I don't consider that a COVID specific thing. I think that's just a common sense reality that everybody needs to do regardless of COVID. Same thing with cleaning. Taking care of those frequently touched surfaces and doing good cleaning practices is just a no-brainer with the different respiratory and influenza-like illness or contact infectious diseases we see with kids. It's just a reality. And then that staying home when you're sick. So critical to do. And our country as a whole tends to have that challenge with presentism of, I can get through it. And hopefully COVID's helped change some of that, that actually impacts a whole lot more people than just you. One of the things that I want to help get across is COVID is a complex, challenging reality. And whether it's listening to me or somebody else, think about where they being humble and talking about what they don't know, what they can't explain, and the uncertainty, because that is pretty pronounced in different times with COVID. Look for those additional changes, and then think about where you're getting trusted information sources. So there is a lot of ways to get information about COVID, and the science continues to change, and we continue to clarify what's happening, what's not happening, and how that needs to adjust our response. And so if the information that you're counting on for COVID does not adjust, does not acknowledge some of that humility and uncertainty, I would encourage you to look for different information. I have had to talk several times to the Edina Incident Command team about, nope, things changed. This is our new science. This has changed. And you got to be comfortable dealing with that. Things are going to change, and there's going to be tweaks and modifications to the process. And I would encourage you to look at CDC and MDH. There's phenomenal staff there working around the clock to try and make sure they're processing the best science to support decision making. And then thinking about schools and myths. So there's a handful of myths that we see questions on, and one of them, a group of them deal with masking. There's concern about CO2 or being able to breathe well wearing masks. We have no evidence for that. Masks, surgical masks and respirators, which are even more restrictive for breathing, are commonplace in multiple industries in our society, not just healthcare. And surgical masks are worn all over the world on a regular basis with young kids to older adults, with no concerns about CO2, oxygen issues, or infections. And so masking, following the guidance from CDC and MDH on the kind of masks and how to wear them and clean them and the type of material to use, there's no safety concerns or issues with masking. And the impact on COVID on kids. Early on, it was easy to talk about. We're not seeing the impact on kids. The magnitude of the impact COVID has had on kids is pretty monumental. So when you think of just in sheer numbers, there's been over 200,000 kids that have been hospitalized with COVID in the last year and a half. We've seen quite a few here in Minnesota. Number been in the ICU. The CDC estimates we've seen about a little over 22 million cases of COVID and people under the age of 18. And we've seen close to, they're estimating between 300 to 500 deaths in kids under 18. That is a shockingly high number. In a really bad flu year, we may see a little over 100 kids die from influenza, and each one of those is typically a really big deal in their community. I've talked to parents, just being hospitalized, let alone getting intensive care, is often a life-changing experience. And we've seen more than we would wanted to see in our community. We've seen 7 kids or under 10 be hospitalized with COVID in Edina in the last year. And we've seen challenges, continue to see those challenges with understanding the impact of COVID on the long term. Some of the studies are saying about 1 in 3 people that have had COVID will have symptoms that last longer than the duration of the illness. And we see that impacting pediatrics too. We also have the multi-inflammatory syndrome, the MISC-C. There's a little under 5,000 cases of that have occurred since COVID emerged in kids. And so there's a lot we don't fully understand about the impact of COVID in kids. Yes, they get sick. And by sick, I mean, we tend to not see, we don't see the same hospitalization and we don't see the same death rates, but we see kids getting sick at the same rate that adults do. And that sometimes means it's easy to say, well, it's not that bad in kids. And so those numbers tell us how bad it is. And then you think about the number of kids in the US that have lost at least one parent to COVID. It is a staggering number. Globally, about 1.5 million kids have lost parents due to COVID. It's about 100,000 here in the United States of kids that don't have a parent because of COVID. And then you think about the mental health, some of the other realities that kids are seeing. It's been a profound impact. And that's something that I don't think you can take for granted. And then vaccination. We hear myths all the time about, well, vaccines cause this, or it affects my fertility, or it does this or that. We actually have a few mythbusters about vaccines for COVID on our website. CDC and MDH do too. Simply put, the vaccines we're using to fight against COVID are incredibly safe. They work incredibly well, and they are our best tool to keep kids in the classroom. If you're like me and have kids that can't be vaccinated yet, we're counting on the rest of our community to be well vaccinated and follow mitigations to keep our kids safe. So if you're still looking for getting a vaccine for your kid or for you, go to vaccines.gov, enter your zip code, and you'll see multiple options for getting vaccinated, or text your zip code to 438829, and you'll get, these are the places you can go get vaccinated. We do clinics at our building here in Bloomington. We're happy to help you get registered for a vaccine. And with that, I don't know, Dr. Stanley, did any questions pop up?
Hi, Nick. Thanks a lot. Actually, a few questions did pop up. And first of all, Nick, I will say, and I will say this to everyone else, with the data that you gave and the studies that you talked about, individuals, there are a few questions where they're asking about the research that supports that. And so we will make certain that we are able to get you to the research that Nick is citing the data from related to student deaths. So I want to make sure that we will get that to you, and we'll make sure we get that posted. Right now we have 110 questions and statements that have popped up. And of those, the vast majority are advocacy for masks or advocacy not for masking. And there are questions about, will we require vaccinations? Right now, the state of Minnesota is not requiring vaccinations, specifically for 12 up. That's the question, and specifically for high school. And so that the state of Minnesota is not requiring that. Questions about hybrid learning. Right now, our goal is to bring students back to school 5 days a week, to be in school all day long and consistently as possible. And so hybrid model is not a model that the Minnesota Department of Education has expected us to develop this year. Is a question, and it's a fair question. Is this truly a listening session, or is it a session and we already have our plan in place? What I can honestly say to you is we don't already have our plan in place. I am intentionally reaching out to the community to garner your considerations, to get information from you, in addition to the emails that I've received, because I understand how complex this is. As Dr. Kelly shared, he had his kids at home learning next to him last year. I am a grandmother, and I know how hard it was on my kids. And so I'm a person where I do believe in garnering voice and garnering the information around consideration. So we do not have that information pre-planned, which hopefully this will help. That will help to explain. There are questions about quarantining and what that will specifically look like in our district. We are currently in the process of reading through CDC information, reading through MDH information, putting together a plan that we will submit to the school board of directors. That information will be in the board packet. And then we do have a board meeting on Monday evening where they will hear the information. My cabinet team and I will present with a recommendation. There's questions about air filtration, and Dr. Kelly shared, and I was really impressed in meeting with Eric Hamilton, the work that has been done to make certain that we have air purifiers in each one of our classrooms, and they have HEPA filters, that we have updated our ventilation systems. We know how important that is. That is really the theme of the questions that are coming forward. And again, what we will do is we will go through every one of the questions. There are some that are statements in there, advocacy statements, but we will go through every one of those questions. We will look for those patterns, and we will make certain that we get those posted on an FAQ so that those responses are there, not just for you, but for the other folks in our community who are wondering about them as well. So, Dr. Kelly, thank you so much for your time this evening. We really appreciate it. I think it is important for our community to have a common baseline understanding of information that we are looking at, that I am looking at as the district superintendent. And so, Dr. Kelly, I appreciate you being here to share that common baseline information.
Well, it's my pleasure.
That's great. So now we are going to transition into the next phase of our time together, and that is using a crowdsourcing tool called Thought Exchange. I am really excited for Laura Milne to join us. Laura is a Thought Exchange leader. I am also pleased because this Thought Exchange is a trial. It is not something that I've had to pay for. It is not something that I've had to pay the facilitator for. Thought Exchange is a complicated technology tool. And as talented as I am with technology, I wanted to make certain that we had someone who was an expert to utilize this tool and to facilitate this process. So I'm going to invite Laura onto the stage.
Hi, Dr. Stanley.
Hi, Laura. It is great to have you here this evening. Again, Laura is a Thought Exchange leader. She has facilitated many thought exchanges. The whole goal and opportunity is for us to be able to hear one another. Right now, we have nearly 600 people. My last number that came across was about 507 people. And you can imagine, there's just no way that we would be able to bring 500 plus people together in one evening to share our perspectives, to really provide us with information and considerations that we should look at. And so this is a way for us to do that, to, as I shared in my outreach video, to eliminate as many barriers as possible, to ensure that as many members of our community are able to be engaged. So Laura, I'm going to turn it over to you so that you can walk us through the process and get us started.
Thank you. Sounds great. Hi, everyone. Thank you so much, Dr. Stanley, for inviting me to be here. And thank you, Dr. Kelly, for that really important information. My job now is to help bring all of your voices into the conversation. I can't believe there are almost 600 people on this stream. So what I'd like to do is offer an opportunity for us to have a virtual real-time network discussion. Essentially, Thought Exchange we're a community discussion platform. And what it does is it allows you to share your thoughts and perspectives on a particular topic in response to an open-ended question, but also allows you to read and rate the thoughts and perspectives of others. So essentially what we do is we prioritize the most important things to us as a group in real time. So in a moment, I'm going to share my screen. You're going to be asked to respond to a single open-ended question. And that question is, based on the information shared this evening and our collective desire to have students safely and consistently learning in person, that's the goal, what thoughts, questions, or considerations do you have to share? So I'm going to ask you to either scan the QR code if you have a phone, or you can go to tejoin.com and type in the 9-digit code that's on the screen. You don't need to put the dashes in, just 9 digits. And then respond to that question. So in your own words, tell us how that information landed with you, and understanding that the desire is to have students safely and consistently learning in person. What additional questions do you have? What considerations or thoughts do you want us to know about? So after you've shared your thoughts, you'll be invited to read and rate the thoughts of others. And what we'll essentially do is find out what is most important to most people by looking at the ratings and what's rising to the top. So I'm going to hit this timer here. We'll be a little flexible with the time. We'll see how it's going. I can see there are already 147, 150 people in the exchange. We have one thought added so far. We'll see that number continue to creep up. I'm going to resist the urge to talk through this because I want you to give the question some thought and respond to it in your own words. And I believe the link, there's probably a link shared as well that I can't see that you can just click on. And if you don't have a QR scanner, then tejoin.com and then the 9-digit code on the screen. So I'll give it another 30 seconds or so, and then I'm going to move forward to a visual of the discussion happening. I just want to make sure everyone has a chance to get in before I do that. Perfect. So, all right, in a minute and a half, we've already collected 109 thoughts. I'm going to click forward here. Please continue sharing thoughts and questions. Please continue rating the thoughts of others if you haven't done that yet. And we're looking now at a live visual. Look at this lovely bird's nest that we're weaving together. That's our conversation happening as we rate one another's thoughts. So something to keep in mind is that we already have over 200 thoughts. You don't need to rate them all. Each person in this discussion is seeing the thoughts in a different randomized order. So the views are being distributed across all of those 240 thoughts. So just try to rate 20, 30 thoughts, rate as many as you'd like. There are some algorithms that are making this an equitable process for level playing field for everyone's ideas. So what you're seeing on your screen here, the thoughts that are rising to the top are the ones that are being highly rated by everyone. So right now, the number one thought says, I agree with prioritizing in-person learning. That means that everyone who's seen that is rating it quite highly. It's rising to the top. So please, after you've shared your thoughts, continue to read the thoughts of others, rate each thought 1 to 5 stars. And that helps district's leadership and Dr. Stanley understand what is most important to most of you. Thank you, everyone, for participating. This is wonderful. So just about 2 minutes left in the exchange. We're just doing a short live exchange this evening to capture perspectives coming out of Dr. Kelly's presentation. These can be longer multi-day conversations, but we're just going to do a quick crowdsource tonight. 415 thoughts. That's wonderful. So continue rating if you've already shared a thought. Continue reading and rating the thoughts of others. We've got about a minute and a half left. So just so everyone knows, tomorrow Dr. Stanley and I will be meeting. We'll be going through all of these thoughts, the 445 thoughts, and still climbing. And we'll be doing some theming and kind of digging into the narrative and where most people are agreeing and where people are misaligned. And we'll certainly work to share back that information. Just under a minute left to get your final thoughts and ratings in. And then we'll take just a couple minutes and scroll through some of these higher rated thoughts, and I'll let Dr. Stanley speak to that. And then I'll let you carry on with your session. So another 30 seconds, get your final ratings in. You can see these thoughts have shifted around as we've all gone in and starred the different thoughts. Some very high rated thoughts about vaccines. Okay. Okay, so I'm going to close this exchange for now, just so we can take a look at the highest rated thoughts. I'll close that up. Thank you so much for participating. That's actually incredible participation in 6 minutes. 469 people weighed in,
Wow.
sharing 486 thoughts. That means that some of you shared more than one thought, which is encouraged and absolutely allowed in a thought exchange. The thing that makes things important are the starring. So we had over 8,000 points of interaction amongst all the thoughts. So let's just let's take a minute here. I'm going to move to the next slide. And I'll just scroll through a couple of these top thoughts. It looks like there's a lot of agreement. The highest rated thought in the exchange: it's important for my child to return to totally in-person learning. It's better for their mental health. So that's a highly agreed upon sentiment amongst these 469 participants.
Yeah, and I would say, Laura, I just have to tell the participants that we are in total agreement as well. My goal is to have students back in school 5 days a week, all day long, and as consistently as possible. So please know that we are in complete agreement with that.
That's great. Yeah, very high agreement here in favor of returning to in-person learning. There's a thought here: we need all staff to be vaccinated.
You know, Nick shared that just period across the state, we have high vaccination rates. You know, in Edina, we have high vaccination rates. We know that, you know, we have teachers that don't necessarily live in Edina. What I have heard is across the state, teacher vaccination rate is very high as well. You know, that is, there are HIPAA HIPAA regulations that I need to follow as superintendent. And so, you know, I've not, asked every teacher to state whether or not they're vaccinated, but we know those high vaccination rates are important, and our teachers want to be safe as well.
Absolutely. And congratulations. I'm coming to you this evening from Western Canada, but I caught the stats, and it sounds like the vaccination, it's already quite a high rate in Edina. So congratulations on that. A highly rated thought here asking for consistent communication in a timely manner, planning for families, staff, and the community.
Absolutely. And that is what this webinar and thought exchange is meant to be, to really be able to, again, engage, with 469 participants, to get feedback in 8,630 ways in such a short period of time is pretty incredible. And I agree. I believe that that communication needs to be consistent and ongoing. And please know, I will lead the effort in doing the best to make that happen. Communication went out with a timeline. I'd like to share the timeline. So we have this information that we're gathering, and we will go through, as Laura mentioned. I'll be meeting with her tomorrow morning to really go through the details of the report of all the data that each one of you has provided us. And then I am working with my cabinet team to make certain that we are looking again at information from Minnesota Department of Health, from the Minnesota Department of Education. We're developing a plan. That information needs to be to the board, and it will be posted on Thursday. And then again, we will be meeting with the board to provide a more deeper dive overview, which you will be able to watch that, or you'll be able to join us in the board meeting. And then that is the overview. And then on August 17th, the board will be coming together to take action on that plan. I realize that we have an early start because of the construction this year, and yet I believe that it is in the best interest of families. It's in the best interest of staff, and of course our students, to make sure that we get this as right as possible. Because we don't want to have to turn around and make last minute changes.
And so much of that is this kind of feedback and open communication. And I see a lot of gratitude in this exchange for the work that Dr. Kelly is doing, and gratitude for prioritizing in-person learning and all the work that's being put in place to prioritize that. The data shared, I think the transparency and the data shared this evening was wonderful. I see that informing a lot of the thoughts in the exchange. I'm looking forward to doing a deeper dive tomorrow. Is there anything else that I can touch on, Dr. Stanley?
I appreciate just your insights, having facilitated so many thought exchange. And again, I appreciate the trial. This was
Of course.
really important for our community, and for you to be able to come through with that. I appreciate that. So actually, I thought we were going to need a lot more time, community, to engage with one another. And that is the beauty of the thought exchange, where we are able to hear from so many people and to get your feedback on what your fellow peers are saying in the community so quickly, that we are actually not going to have to keep you for much longer than this. So again, thank you so much for joining us. At last count, I heard that there were 560 plus people that were on this evening. And what that shows me is what I have learned as I've been out and about in the community. Edina is amazing. We care. And what I want you to know is I care. I care about you. I care about each one of your children. I don't take it lightly that I have that responsibility. I care about our staff, and we are going to do our very best to make sure that we get this as right as we possibly can during a pandemic. So thank you for your time this evening, and continue to look for updates. And again, the first will be the overview that we will submit, that will be posted for the board packet on Thursday. Thanks, and have a great evening.